Mute. Okay na. Okay na. Okay, good morning.
Morning, Doc.
Morning. Ayan. So we'll be having the viruses this morning. Where makita ang picture? Okay. So the topic for this morning is on the parvoviruses, adeno, and the herpes virus group. These are all DNA viruses. Okay. So, ano ba? What have you? Maybe not naman natin here. So, ay, ano ba? Okay. So, generalities on DNA viruses. Okay, so all DNA have double-stranded DNA. All DNA viruses, sorry. They have double-stranded DNA except for parvo. So the one that we will have this morning. So you remember that. All DNA viruses have a double-stranded DNA molecule except for parvo. Then all DNA viruses have a linear DNA except for papilloma, polyoma, and the hepadnaviruses. So, maganda to pang ano, pang multiple choice question. Okay. Then all DNA are icosahedral in symmetry except for the pox virus, which is the biggest of the viruses of pox. Then all DNA replicate in the nucleus except for pox. So pox virus will replicate in the cytoplasm. So the rest of the DNA viruses replicates in the nucleus. So all have a double-stranded, all have, except for parvo, all has a linear DNA except for these three, PPH, papilloma, polyoma, and hepadna. Then all are icosahedral except for pox, and all will replicate in the nucleus except for pox. Okay, sorry, bit valid. Okay, so on the lecture on the introduction to viruses, you have come across terms like naked and enveloped viruses. Okay, so these are the group of naked DNA viruses. These are the viruses that we're going to have this morning. The first two. So parvovirus B19, it is transmitted via respiratory or can be transmitted transplacentally. It has no oncogenic potential and there is no vaccine available yet. Then adenovirus is transmitted via respiratory or via fecal-oral mode of transmission, and it has no oncogenic potential, and there is a vaccine for adeno. While human papilloma virus is transmitted by sexual or skin contact. So sexual contact and skin contact, and this one has an oncogenic potential, so it can cause, this has been implicated to be a cause of cervical cancer in women, and there is a vaccine available for this. Okay, so maybe some of you has already had the HPV shots. No, it comes in 3 doses. I think late last year, or was it early last year, the DOH was giving this one for free. And but before you can have the papilloma vaccine from pediatrician or from the OB practitioner, and it's quite expensive. So we recommended the papilloma vaccination to 9 years old and up. Okay. So these are all naked viruses. That means they do not have an envelope. Okay. Okay. So the first group that we're going to discuss are the parvoviruses. So this is the structure of a parvovirus. It has a single linear, the red structure here. That's a single linear DNA genome. And then it has this BP, a unique structure. The BP region is a minor capsid protein, and the major capsid protein, which is BP2, the green bead-like structure. Then the red structure is the BP1, or the minor capsid. So, okay, generalities on parvoviruses. They are the smallest of the DNA viruses that belongs to family Parvoviridae. Then they have an icosahedral symmetry, naked or no envelope, and it contains a single-stranded DNA. So human parvovirus, or the parvovirus B19, is the only known parvovirus that is pathogenic for humans. And this particular virus will show a tropism for erythroid progenitor cells. Okay. So how did it get its B19 name? So it's contain trivia. So in 1974, a scientist, Cossart et al. And company first identified B19 while evaluating test for hepatitis B virus surface antigen. Para accidental ano lang to niya, finding. The name originates from the coding of a serum sample number 19 in panel B. So yun, naging Parvo B19. That gives an anomalous results when tested by the counter-immunoelectrophoresis and radioimmunoassay. So while evaluating for your Hep B virus surface antigen, he found out that there is another thing in that sample. So from sample number 19 in panel B, so that's how the B19, Parvo B19 came about. Okay. So the genus Parvo includes viruses which include animal viruses of veterinary importance, such as your feline or your cat, Panleukopenia virus, and the canine parvovirus. So this can cause a serious disease in your pet dogs. Okay, I had one very small pet, very small dog that succumbed to the canine parvovirus. Then the genus Erythrovirus, which consists of B19, it's the only member of the Parvoviridae that is known to cause disease in human. Okay, so the canine and the feline Panleukopenia virus, because this is in animals, so they are animal viruses, but it's only the B19 that can cause disease in humans. So important properties, the virion is icosahedral. So this is the size of the virion, 18 to 26 in diameter, with consisting of 32 capsomeres. Composition, it's DNA 20%, protein 80%, single-stranded DNA linear, 5 to 6 kilobase, protein, one major BP2 and one minor BP1 protein. So it has no envelope. It replicates in the nucleus and dependent on the functions of the dividing host cell. So its outstanding characteristic is they are environmentally stable. And the human pathogen, the parvovirus that can cause disease in human, that's the B19, has tropism for red blood cell progenitors. So the young or the precursor cells of your RBC. So antigenic properties, there's only one serotype of B19. And then it's highly resistant to inactivation, but can be inactivated by formalin, by beta, propiolactone, and oxidizing agents. Then it can withstand heating at 56 degrees for 30 minutes, and they are stable between pH 3 and 9. So human diseases associated with the B19, we have this group. So you have the erythema infectiosum, or known as the fifth disease, the children's fifth disease. So there is such a thing as a first, second, third, fourth, fifth. Okay. So fifth disease is the fifth disease in children is due to the parvovirus. Okay. Did you get to know what was the first, the second, the third? A lecture na ba? Lecture na lang. Measles. Okay. Measles is one of the five disease children, exanthematous disease in children. Then this one can also cause disease in adults. This can infect children as well as adults. So what's the clinical feature of erythema infectiosum? It is presented as a cutaneous rash in children. Again, and then arthralgia or arthritis in adult. So adult who gets parvovirus B19 infection gets manifest as arthralgia or arthritis. Okay. Then it can also cause transient aplastic crisis, especially in hosts with underlying hemolytic disorders. And the feature is a severe acute anemia. Why? Because this one attacks your RBC progenitor cells. Okay. So it's predilection for your progenitor cells or the precursor cells of your RBC. So what will happen if you get infected? You get this condition known as a transient aplastic a crisis resulting to a severe acute type of anemia. Then another condition is pure red cell aplasia, especially in immunodeficient hosts. So the feature is a chronic anemia. Then in fetus, can be infected. They can lead to hydrops fetalis, and the feature is fatal anemia in the fetus. Okay. Pathogenesis and immunity. So it has tropism for two types of cells. Okay, your RBC precursors and the endothelial cells in the blood cells. Okay. So the virus infects rapidly dividing erythrocyte precursors such as bone marrow cells, the erythroid cells from fetal liver, and erythroid leukemia cells, and destroy these cells after infection, thereby causing a aplastic type of anemia. So infection of the endothelial cells in the blood vessels can lead to erythema infectiosum, or the rash, the cutaneous exanthematous rash. So it has been demonstrated that B19, you first enter through the nasopharynx or your upper respiratory tract, and then it spreads to the blood, causing viremia. Then the virus then infects mitotically active erythroid precursor cells in the bone marrow and establishes the infection. The virus enters susceptible cells through the P blood antigen receptors on the erythrocyte precursors. Then inside the red cell, virus enters the nucleus, starts replicating, followed by killing of the red cells. So the production of RBC is stopped for approximately a week due to killing of your precursor, RBC precursor cells by the viruses. So initial stage is associated with the flu-like illness caused by large viremia. Then viruses are shed in the oral and respiratory secretions and even across the placenta. So they can be transplacentally spread. And subsequently, viremia is controlled by production of specific antibodies against your V19 virus. So rash and arthralgia present in the second stage of the disease is believed to be immunologically mediated. So this stage coincides with the disappearance of your B19 from circulation and the appearance of B19 virus-specific antigen, IgM and IgG antibodies, and finally formation of an immune complexes. It could lead to your arthritis and arthralgia. So these are an illustration of the clinical syndrome associated with Parvo B19. So a bright red rash develops on both cheeks that appear as they have been slapped. Or otherwise, this is in some textbook, you will come across term like the slap cheek syndrome or the slap cheek rash. So both cheeks of the child are reddish, erythematous. So it's the slap cheek syndrome. Then the rash then appears on the trunk and spreads gradually towards the arms and the legs. So the lower picture is a child. I think this one is a boy. So he has the redness over both cheeks and then rashes in the upper part of the body. So the condition usually subsides within 1 to 2 weeks. Then how is aplastic anemia brought about? So the transient but severe aplastic anemia, they can occur in children with chronic anemia, such as those with sickle cell anemia, thalassemia, and spherocytosis. So after infection with B19, so they can develop a transient severe aplastic type of anemia. Then they have this gloves and sock syndrome, which is another complication due to the B19. So in this syndrome, erythematous exanthema appears on the hands and the feet. That's why it's called the gloves and sock syndrome, with a well-defined margin on the wrist and the ankle joints. We have picture of that. This is the characteristic socks and glove and sock syndrome. Okay, so in pregnant women, B19 causes reinfection in a pregnant mother who is infected earlier. So if a pregnant mother gets reinfected, so that mother has already antibodies to the B19. So she is already immune to the virus. So there will be no adverse effect on the fetus. But in a non-immune, zero-negative pregnant mother, B19 infection is increasingly associated with the risk of fetal death. So the infection may cause severe anemia in the fetus, and subsequently the fetus will develop signs of high output cardiac failure or hydrops fetalis. However, your B19 does not cause any congenital anomalies in the fetus. So this infection occurs with immunocompromised, your chronic B19, such as patients with HIV and those receiving immunosuppressive therapy and transplantation. So chronic anemia, leukopenia, thrombocytopenia are common manifestations. So it can infect both children and adult, your B19. So epidemiologically, this is geographical distribution that's worldwide. B19 is worldwide in distribution. So the exact data on seropositivity in population world over is not known, so there's no data. Approximately 90% of adults older than 60 are seropositive in the US. So that's the only data we have, just taken from the US. Then similar data from other parts of the world are lacking. So B19 is strictly a human disease, and the humans are the only reservoir of the infection. So the viruses are excreted in the respiratory samples, which are the primary source of infection for parvovirus. So a patient who has parvovirus B19 infection is contagious from 24 to 48 hours before developing prodromal syndrome till the appearance of the rash. So it's transmitted via vertical during birth, could be through respiratory route, through the respiratory secretions, or percutaneous exposure to blood and transfusion of blood and blood products from infected individuals. So like, what are these blood products? You have the pooled RBC, platelets, or IV immunoglobulins. So for lab diagnosis, since it's very hard to culture viruses, diba? Because viruses can only be grown in a living cell. So you cannot grow that in plate that in the blood agar, chocolate agar, whatever agar plate. Okay. So how to come up with a diagnosis is through the blood. So using detection of specific IgG and IgM antibodies in the serum for diagnosis of erythema infectiosum. Or clinically, we can make a diagnosis of B19 infection. Then a more sophisticated laboratory diagnostic procedure is doing the ELISA or a radio immunoassay or RIA, and indirect fluorescent antibody technique. So demonstrate the presence of IgG and IgM antibodies. But not all laboratory can do this, only in higher centers where they have this more sophisticated laboratory diagnostic to do ELISA, RIA, and fluorescent technique. Okay, so at our setting, clinical, look at the picture of the patient. Then if your laboratory is capable of demonstrating IgG, specific IgG and IgM, that's good. So in pregnant women, the serum positive for IgG and IgM indicates B19 infection within 7 days to 4 months and a possible risk to the fetus. But a positive IgG but a negative IgM indicates only past infection, so hence there is no risk for the fetus. Then furthermore, you can do PCR, polymerase chain reaction, to demonstrate the B19 genome in the blood. The positive results suggest viremia or infection. So treatment, there is no specific antiviral therapy for the B19. So they give just supportive symptomatic management. So prevention and control, there is no specific measure available for prevention. And the vaccine is undergoing, for B19, is undergoing clinical, phase 1 clinical trial. Naunahan pa ni COVID. From the Permilang phase 1 clinical trial, because it's not much of a threat, not like COVID. So, yeah. And anyway, yeah, viral, self-limiting siya. Okay. So the next group are the adenoviruses. So again, these are DNA viruses. They're naked. So this is the structural configuration of an adenovirus. Again, it has a single linear DNA structure. Okay. So it's icosahedral, 7 to 80 nanometer in diameter, composed of 252 capsomeres, and fibers projecting from each vertex. So DNA is 13%, well, that of the parvo it's 2080. Protein is 87. It's a double-stranded DNA, linear, protein bound to terminal, and it's infectious, this one, the DNA. Important antigen, protein, important antigen, hexone, penton-based fiber associated with major outer capsid protein. So this one is naked, no envelope, it replicates in the nucleus. And the outstanding characteristic of adenovirus is they serve as excellent models for molecular studies of eukaryotic cell processes. So the first adenovirus was isolated in 1935 from a human adenoid tissues. Since then, there were at least 52 distinct antigenic types and many other types from human, isolated from humans, and several other types from animal. So a lot, no? 52 antigenic types. So all human serotypes are included in a single genus within the family Adenoviridae. So the clinical finding is it can cause respiratory diseases. So not so distinct for this particular virus, because other viruses can also present with this: cough, nasal congestion, fever, and sore throat, like your rhinoviruses, your coronavirus. Okay. Then most common in infants and children, this manifestation, usually involving group C viruses. Then we see there are 52 types, serotypes. So types 3, 7, and 21 can cause pneumonia in 10 to 20% in children. Then 4 and 7, and occasionally type 3, can cause acute respiratory disease among military recruits, and they occur in epidemic form. So for us to it's here for us to remember what adenovirus can cause or can give us. So I just included some of this picture. Okay. Some of this picture. So it can cause pharyngitis. Major cause of infection associated with non-bacterial pharyngitis and tonsillitis. So when you get to see a patient who comes a difficulty of swallowing, and then you look at the tonsils, they're quite red, and so not all needs to have an antibiotic. You know? Pharyngitis and tonsillitis can be of viral origin, and one of those viruses that can cause pharyngitis and tonsillitis are your adenoviruses. So adenovirus, pharyngitis, can cause febrile common cold. So just like any other of the other viruses that I mentioned earlier, like your corona, the corona COVID, you can start with a cough, colds, like a common colds, parang flu-like presentation. Then the common types are types 1 to 7. These are the common types of the adenoviruses. Then aside from pharyngitis, it can cause pneumonia. Types 3 and 7 are associated with pneumonia, which resembles like the atypical pneumonia in adults, while type 7 causes a serious and even fatal pneumonia in infants and in young children. Then another condition associated with this is keratoconjunctivitis. And it occurs in serious epidemic, but keratoconjunctivitis, sore eyes, we call in Waray-Waray, and ito piskat na. So it's caused by serotypes 8 and less frequently with 19 and 37. So this is the conjunctiva, very red conjunctiva. And so many of the adenovirus replicates in your intestinal cells. So at the first slide, when I showed you the 3 groups of naked DNA viruses, I said that this can be transmitted by fecal oral. So many of these replicates in the intestinal cells and then present in the stools without being associated with a GIT disease. Okay, so they can be isolated from the stools, but the patient is not manifesting any clinical signs of the disease. Or it can cause infantile gastroenteritis. So infantile gastroenteritis has been associated with serotypes 40 and 41. So other manifestations due to adeno, it can cause acute follicular conjunctivitis. Types 3, 4, and 11 are responsible. By the way, do not worry much on the numbers. Okay. I think masig ma-overwhelm kasi ano ba ito, acute follicular conjunctivitis nga type. Just good to know that the adenovirus group, they can cause acute follicular conjunctivitis, keratoconjunctivitis, pharyngitis, they can cause pneumonia. So adenoviral and chlamydial conjunctivitis are clinically similar. Diarrhea not conclusively established. Then acute hemorrhagic cystitis in children, types 11 and 21 are responsible. So I just, to be specific, but I don't go for the numbers. So, for so many things, so many things to ask, for examination purposes. Dilatak sugadit kakuti. Sorry. At yung mga types 3, 4, 11. And aside from hemorrhagic cystitis in children, it can cause mesenteric adenitis and intussusception in children. So they had been implicated in this. Sorry, COVID na. So, bali respiratory as well as GIT manifestation secondary to adenovirus infection. Okay, so adenovirus as vector in gene therapy. So in gene therapy using adenovirus vector, so a new gene is inserted into an adenovirus vector which is used to introduce modified DNA into a human cell. So if the treatment is successful, the new gene will make a functional protein. I just included this slide because during the initial phase of the COVID vaccination, there were a lot of hesitations, especially in the community, because there were some fake influencers telling